Okay, good afternoon, friends. Am I audible?
Yes, sir.
Am I audible? Just somebody can say, Riddhi.
Yes, it is audible. Yes.
Yes, thank you. So, thank you for joining. This is overwhelmed. I'm really happy. A lot of participants are interested to join this session. Today, we are going to take a 1 hour session on particularly mastering the ICMR grant research proposal, a comprehensive online orientation, development and submission of the research proposal to ICMR, small grant and intermediate grant, extramural research grant. So I think we'll start in this fashion. First off, I will take Dr. Neeraj Pandit. I will introduce myself later. We'll focus on the prerequisites for the submission and creation of login ID on the web page. This is very important part to understand to all the faculty. Then also step-by-step submission. Once you created login ID, submission process I will focus, and core research area of ICMR for this small and intermediate grant. In second half, Dr. Suresh Rathi from the Sumandip Vidyapith Research Cell. He is the Deputy Director Research Cell in Sumandip Vidyapith. He will focus on the evaluation process and process of making a good proposal. So we'll take a 1 hour session, then question answer. I request all the participants who have any question, write in the chat box. Rather asking, it's better to write in the chat box. We will take question one by one, time permit. And if personal query, you can write in the mail. I have given the mail in that particular form also, as well as in link I sent by this mail ID. You can send this mail your personal queries. So, I am Dr. Neeraj Pandit, Professor Head Community Medicine Department in SBKS Medical Institute and Research Center that is affiliated with the Sumandip Vidyapith that is located in the Gujarat, Vadodara. So what are the session's objective? We are trying to understand why do we need this session. I try to be focused because I am working in this research almost more than 20 years. And last 10 years, I am trying to motivate UG student, PG student, as well as faculty for the research. So why this session we thought of for all over the India. Prerequisite for the proposal submission, then process of creating login ID, understanding the core areas, and any other queries question we will take a last after discussion with the Dr. Rathi's session. So why do we need this session? This is very interesting. I think everybody is sitting here, they are knowing about what is going on in this ICMR. Post-COVID, Indian Council of Medical Research and Department of the Health research grant is available. And lot of research grant is available. There are a lot of calls upcoming for the research. And they are inviting from all over the India scientists. And see, the most important last year, similar type of the call was there. That is small and intermediate. And result was published. That is available on the website. You can see what is the result. See, in the intermediate grant, it is submission where 1800 plus. Out of them, 101 PI received the grant actually. See, this is very important. 1800 submitted, of them 101 received the grant. Approval and process started. Now, second part is important. And out of this 101, 41 medical institute. But in this, out of 41, 10 are medical colleges. Other are the AIMS, like big institute. AIMS, you can say PGI, Chandigarh, or you can say Pondicherry, Postgraduate Institute. And in this 10 medical colleges, majority are the nationally known medical colleges like CMC Vellore, you can say you can say Amrita, something like a big medical colleges. Very few. See, in India, more than 700 medical colleges are there. So we need to keep in mind everybody can participate and everybody can join this research opportunity. Now, see the second grant, that is a small grant. The small grant submission total submission were 8,200. And out of them, 527 were awarded a grant. Of them, 45 plus PI from the medical colleges. They are the medical colleges. See, 527 and 45, you can say a 10%. Okay, so this is very important, and this is my main interest. Medical colleges, dental college, pharmacy college, nursing college, everybody can apply. Even now, audiology, physiotherapy, they can also apply. Quite a few dental faculties and other faculty also received grant in this time. This list is available on the ICMR website. You can go through the list and you can try to understand who are getting the grant. Pharmacy is a good area of innovation and discovery. So I think pharmacy as a medical college, you can join with the pharmacy for new discovery area, innovative area, and you can join the things. So this is the basic reason. Considering the 700 medical colleges in India, 150 around or 200 staffs. So you can consider almost 1,40,000 faculties are there. Okay, so at least we can submit more than 10,000, 15,000 rather than 8,000. This year, we should submit at least interested people who submit the research proposal in ICMR. So it's a good competition for the grant. So because of this session is organized. I hope everybody will join actively and participate in this grant proposal. What is the difference between small and intermediate? Small grant means it's a grant between 10 lakhs to 2 crore, less than 2 crore. And intermediate means 2 crore to 8 crores. So this is the amount they are giving for the research. Duration, 1 year to 3 years. So this is the duration and everything is written. We will brush up. But before that, most important prerequisite. Prerequisite online mode of application only by PI. So you can make a group of investigator, make somebody as a principal investigator, and this principal investigator can work on this and submit. Who can? Scientists, professional who have a regular employment in medical institute, research institute, universities, colleges, recognized research and development laboratories, government and semi-government organization, NGO. All this government, other than government, all other institutes should have a recognition of DSIR certificates. This is Department of Science and Industrial Research. You can say a zero certificate. So your private organization, whosoever working in the private organization like us, they should have this DSIR certificate. And this is your dean office, or you can say account office knowing about this part. If you don't know about this part, you can come search on the Google, you will get the information. So you have to apply this, and within 3 months, they are issuing this certificate. So you can apply. Currently, there is one condition. If your institute is in process of application, still you can write, we have a in process of application, and it will be available soon. So you can try this. Next is your portal, epms.icmr.org. This portal is very important. You need to open this portal, and if you are sitting on the computer, you can try this, and you can try for this particular thing. Okay, you are not able to see face. I thought, wait a minute. Okay, sorry. Is it okay? I think. So you can try the things at the level of yours. If you open your computer, open the window with this web page and try to register. If you have registered, there are almost more than 500 participants registered for this workshop. And I asked the question, how many of you? 1/3 has already a login ID password for this particular things. So when you just click, you will get this type of the window. If you are new registration, you can go through the registration form, and you are already registered, you can log in, password, captcha, and just enter. So this is the way you can enter. Okay, this part is very, when you are doing the first time registration, they are asking your full name, email ID, mobile number, password, confirm password, and captcha, and submit with terms and condition. Here, once you register, they will authenticate your email ID. Without authentication, you cannot go further. So you have to get some email from the ICMR immediately. If you are not going to get the email, you will not be able to get the authentication. So sometimes it's delayed, maybe 2 or 3 days. If within 24 hours you will not get the authentication link, you can directly call to the ICMR. Number is given on the video, particularly on that call. You can, if you open that call, in the last page, it is written email ID and mobile number, landline number. You can call and ask for the registration. They will authenticate the things. Okay. Once you authenticate, your page will look like this. Okay. And first part after authentication, you have to go for this profile. And this, without profile, you cannot go ahead anywhere on this page. So you need to open this thing and you need to go for the profile. So in this profile, what you have to add? So first is a personal detail. This personal detail requires your name of the PI, designation, email address, contact number, gender, category. This is very important. Proof of birthday, date of birth, board examination number, passing year. Then you need to upload the document, particularly date of the birth. They are very serious on this aspect. You have to upload your school leaving certificate, or you can say a board exam, 10th board exam, where the birth date is always there. So you can try to be on this particular part and you can upload the document. Then working institute location, name, nature of employment. Keep in mind, nature of employment must be a permanent. If you are ad hoc, if you are a contract, you won't be a part of this call. So permanent employment person can only join for this call. So this is also very important. And then department. Once you upload this part, you need to go for the second particular, that's education. You have to upload your educational detail. Then research experience. Okay, research experience is also important, whatever you have, but out of this, personal details and educational details are very much important. You have to minimally fill this two completely, then only you can able to go for the call. Otherwise, you won't be able to call. Research and publication, patent, award, these are the is not compulsory, but first two are very much compulsory for submitting the call. Okay. Once you finish this job, you can start with your next window, and that is a window is particularly the proposal submission. Once you are ready, you can go with this particularly proposal submission. Okay. Now I am showing here about the proposal submission component, but before that, you have to be a very much ready with completely whole proposal, then only you can submit. So this process I am showing, once you are complete, you can pass through this particular process. Otherwise, it will create a complication. So in proposal submission, once you click the proposal submission, you will get an idea about what is a call. This is a call. Once you select, there are two calls for the investigator initiative research proposal for intermediate and then small extramural grant. The difference is amount. 10 lakhs to less than 2 crore is a small grant. 2 crore to 8 crore is an intermediate extramural grant. Okay, so these are the two call you can select and you can go a next. So once you go select small extramural grant, here I have selected. And see, this is the thing. Here it will start with a last date time, apply a new proposal. View applied. If you have a draft proposal, you can see here, and new proposal, you can click on the new proposal and you can start on this submission process of the new proposal. Okay. So now once you click on the new proposal, what will be seen in next window? Next window is complete call for proposal, then priority area, condition, and this is the things, this is intermediate. Similarly, you have to keep in mind, this is of the intermediate small grant. You have to select this part, you have to fill this part. Proposal detail component will be taken by Dr. Rathi. So I am not going in the detail. You have to completely copy and paste everything here on this page. Okay, so there are many parts of the components here in which introduction, objective, everything you have to fill. You have to write 100 words, whatever the things are there, they are already said. Dr. Rathi will tell detail about the proposal. So I am not going into detail that part. Next, once this page is over, there will be next page is objective-wise methodology. So here, you have to be very clear in your proposal, what are your objectives? And once objective, how will you achieve with the method? So you have to add here objective-wise methodology. So copy objective 1 to study the prevalence of something here. Click here. Save objective. So automatically it will come here like to assess the growth trajectory Indian children and teenagers aged 2 to 19 years. Okay. You can second objective, it will be here below, and third objective. So these are the 3 objectives. Now next part is very important. So you have to prepare your methodology accordingly. Don't forget. Now you have to click on, you have to click add methodology component of this. Once you click, the window will be like this. Study design. For that particular objective, what is your study design? What are the study area? You can do a multiple community, hospital, laboratory. Sample size estimation and sample strategy. Project implementation plan. Design of the statistical analysis. Save. So whatever number of the objective, you have to add methodology. 1, 2, 3. 3 objective, 3 methodology. So prepare your methodology accordingly. Don't forget this part. Now come to the next. Once method is uploaded, PI, co-PI details. Now keep in mind here, your co-PI also has to create an account on this particular page. Okay, once you add a mobile email ID, all details will come automatically. You cannot print detail here. So you need to tell your co-PI to register on this portal. Once he registered and updated all the information, you put the email ID, immediately you will get all the details, the things here. Okay, so all PI and co-PI need to be registered on the system. And this will become on the next page. Now, after this, move to the next page, go on the next page. Document to be uploaded. You need to upload 2 documents. Both are very important, compulsory document. Without that, you cannot move on the next. So declaration and attestation form duly signed by the head of the department, director or institute. So here you have to upload the declaration and attestation. What declaration? Your head of the institution is giving the declaration that this doctor name XYZ department of this particular working in our institute as a full-time permanent staff, and we will support the doctor for the ICMR research project for the financial point of view, and all required nitty-gritty institute will support. So that document you need to upload, signed, duly signed and stamped by the head of the institute, and upload here. Second, additional supplementary information including the figure, table, flow diagram, etc. can be said. With your proposal, if you want to add something, you need to add something, because you cannot say without this page it will be uploaded. This page will, I think this is not compulsory. This is very compulsory. Star is there. Here is not star. So if you want to add, you can add the documents, additional document in this page, and then move the next. Now in next move, budget. This is very important. How ICMR looks like look in the budget. The heads are very important. You can see a staff, contingency, consumables, equipments if approved, travel if approved, overhead charges, and total. So you have to decide what are my requirement for this project. How many staff is required? And see, ICMR staff salary is very clear. They have revised the staff salary and things. You can get that document also. You can get this document, this salary details document on the ICMR website. If not, you can write to the mail me. I will give you the salary document because they have defined salary. And salary is very good salary. So main, you can take a good technical staff with you and you can plan your very good research and implement this research at the ground level. So the heads are very meticulously staff, contingency, consumables, particularly laboratory and consumables, because it depends on your project, which type of the project you are going to handle, and that is depends on the things. Next is equipment. Okay, here the word equipment you need to keep in mind. Simple equipment ICMR will not give. Specialized equipment which is required for this research project. It is not that NMC requirement equipment you can ask from the ICMR. That equipment must be with the medical college, dental college, or physiotherapy college. Additional something new, if you want for the project, that you can ask. Travel component is also very important because there are many community medicine like project we are going in the travels also. So travel related and overhead charges, they are giving the 3% overhead charges to the institute to handle this project. And this way you can prepare a budget. There are many people who wants to understand the project. I think project budget, we can separately or individually deal with the people who are interested. You can write a mail. We will reply to you regarding your project related budget. Next. Then come to your priority area. See, this is very important. Here, ICMR has already given the priority area, 3 priority area: communicable diseases, non-communicable disease, reproductive, maternal, and child health nutrition. Okay, research proposals that are aimed at the finding solution for the prevention, screening, diagnosis, treatment, or rehabilitation of the following diseases or the condition will receive the preference for the funding. These are the area. Now, these are the broad area. Okay, you can say One Health is a very big topic. Okay, you can match many things with the One Health. Tuberculosis. Government is interested to eliminate the tuberculosis. Antimicrobial resistance, it's a big talk. Malaria, vector-borne disease, sexually transmitted disease, HIV, influenza, other respiratory, gastrointestinal infection, sepsis, meningitis, urinary tract infection. These are all the communicable diseases. Non-communicable cancer, breast service oral is written, but any cancer, if you have something innovative idea in your mind, you can go ahead. Diabetes, anything, cardiovascular disease, anything, chronic respiratory disease. Okay, this is mainly important chronic respiratory disease, chronic neurological illness, chronic kidney disease, chronic mental health disorder, chronic liver disease, trauma, burns, oral health problem, NCD risk factor, diet, activity, alcohol, tobacco, blood disorder, thalassemia, sickle cell, clotting disorder, climate change, impact on the health, eye condition, ENT condition, aging, elderly, genetic, everything. Reproductive, see, very interesting. Preconception care, antenatal care, internatal postpartum care, postnatal care, low birth weight, neonatal sepsis, early childhood development, malnutrition, breastfeeding, complementary feeding, anemia. So there are a lot of areas. And in which anything you can say a promotion, prevention, screening, diagnosis, treatment, rehabilitation. You can select your area, you can go at this. Now the timeline. See, this is very important timeline. You can think over about this timeline, and this timeline part is very important here to understand. Because submission already started, and this submission started with 1st January 2024, and it will be end. Small grant will be end by 21st February at 5 p.m. and intermediate grant will be end by 29th February 2024. And review selection May 2024, final submission June 2024, and approval and release of fund by September 2024. So by September 2024, you will get a approval and fund in your institutional account. So this is a timeline. So you have a time now. Today is the 5th of January. You have a last date of 21st and 29th. But don't wait for the last date. I suggest to go ahead with as early as possible. Once you have proposal ready, submit without delay. Because last moment server issues are always there. And because of that, you may be in the trouble. And no extension will be given, I think, as per their routine. Last 2 years, my experience, they are not giving the extension for any proposal submission. Okay, so this is something about the timeline. Now budget. Budget, as I already told, small grant 10 lakhs to 2 crore and extramural grant 2 crore to 8 crore. So this budget proposal format already given in that particular proposal, you can see that detail head-wise, and this head-wise discussion, as I told, whatever written here, same part is there in the budget part given in that proposal format also. But you need to visualize your budget. You need to be very clear on that. What are your requirements for this particular project? Okay. So this is something about the budget. And this is part from my side about, keep in mind the line, I end with this, my line, poor surgeon hurts one person, poor teacher hurts 130, but somebody said, added that poor researcher hurts million. So researcher should not be take everything as a casual. It should take a very positively, very seriously a research. So now I hand over the mic to Dr. Rathi. Dr. Rathi is here only. So I am just stop the screen, sir. I request Dr. Rathi to share the screen and go ahead. Dr. Rathi.
Yes, thank you, Dr. Neeraj.
You can write your question query in the chat box rather than asking, it will be the better. Yes.
I think my screen is visible to everyone.
Dr. Rathi, your voice is still not coming.
1 minute.
आपका ऑडियो नहीं आ रहा है ऑडियो, आप म्यूट हो, अनम्यूट कर जी. अनम्यूट कर दीजिए. Now,
Am I audible?
Still your voice is not coming.
Can you hear me now?
I think audible. Somebody said audible. I am not able to hear. Yes,
Can you hear
can
me?
try. Yes,
Yeah,
yes,
yeah.
audible. Yeah.
Good afternoon, everyone.
Good afternoon. Please continue.
Yeah. Thank you, Dr. Neeraj. So what Dr. Neeraj basically told you, I am going to fill the gaps. Whatever we are developing the proposal, and you have to add just in the ICMR format. Okay. So I will call it basically, these are the format for the calls. Nuts and bolts are issues of the calls. So ICMR wants 4 type of research. Number 1 is discovery, already Dr. Neeraj mentioned. Number 2 is basically developmental research. Number 3 is delivery research, which is also called as implementation research. Number 4 is descriptive research. They are now giving less importance to descriptive research until and unless there's a very good, something different, something unique idea is there. Otherwise, they are not giving much importance to descriptive research. Okay, but we need to develop the proposal on their priority areas. As Dr. Neeraj already mentioned, from the communicable disease point of view, from the NCD point of view, and from the reproductive child health and nutrition point of view, Dr. Neeraj already mentioned. Just see the red asterisk mark, these are the high priority areas. So if you are developing the proposal on these areas, then chances are more to get the funds. You know, these are the all such areas. Okay. Now see for the duration of the project and funding. Already Dr. Neeraj mentioned about the duration, that is maximum duration is up to 3 years, and the additional 6 months can be given, but with no cost can be given for the preparatory activities. And small grants, which is from 10 lakhs to less than 2 crore, intermediate grants are from 2 crore to less than 8 crore. This is their maximum subsidy. Now coming to the format of the proposal. It is called as Annexure 1. Annexure 1 has two parts, A and B parts. A parts has 14 questions or points, which we need to fill. So develop your proposal on the Word documents based on the 14 points, and then from this copy and cut and paste into their ICMR format, online format. Now, title of the proposed research project. This should not more than up to 25 words. It should be specific, concise, and sufficiently descriptive and informative. What should you consider something carries the meaning? From this title should be catchy. That's what we are saying since very long. So it should be very specific, you know. Okay. And very precise or concise. But please make sure that there's no personal identified information of PI or institute should be included in these 14 points. Now, after title, we need to put the summary of the whole proposal. Summary of the whole proposal. So first develop the proposal, then write down the summary. So second point is summary, which should be up to 250 words. It should be in subheading wise. It is known as structured summary. So first is rationale, or what are the gaps in the existing knowledge. Second point is novelty, what is new thing, what is different thing. Then objectives, methods, and what are the expected outcomes. So these are the 5 points which basically you need to describe these 5 points in 250 words, which is called a summary. So, third point is, does it cover a priority areas? As we discussed, there are 3 top themes. Among these, there are several priority areas. So from non-communicable diseases, from communicable diseases, and from reproductive health issues, nutrition issues. Let's say you are looking for adolescent health issues. Then directly your proposal will go to area number 3. Okay, priority area, basically on reproductive health. And among this, whether it's a primary area or secondary area. Let's say if you are selecting some cancer, then it is in non-communicable disease. So does it cover priority areas? Yes. If yes, then select the most appropriate from the list. List already shared with you from the table. Then write few keywords, 6 keywords, so which is separated by comma, which is best describe your proposal. Let's say they are basically in the while looking after evaluation process, they are just writing the keywords. Let's say cancer, or let's say breast cancer. So your proposal should come directly like that. So there should be at least 6 keywords should be there. Fourth point is keywords. Now, in the proposal, whatever you have used, some abbreviation, some standard abbreviation like WHO, like NMR, like MMR, so you can provide their full abbreviations. And also, it should not more than 10 in the proposal. So fifth point is abbreviation. Write down in the point wise. First point, title of the proposal. Second point, summary of the proposal. Okay. Third point, in the priority areas. Fourth point, keywords. Fifth point, abbreviation. So far, we have covered only 5 points. Okay. Someone has a question asked to kindly share the priority areas. Yes, definitely will share. Now, sixth point is known as problem statement, which should be up to 500 words. Ideally, you should develop less than 500 words while copying paste in the format, in the online format, it should go. Otherwise, if there's a 501 word, it will not be accepted. So problem statement basically means what is currently available information to the present problem. And it should be up to 500 words. Then rationale, why you want to conduct this study. Mention how the research question addresses the critical barriers in scientific knowledge. What are the technical capabilities or programmatic issues, or clinical or laboratory issues, practice, and its relevance to local, national, and international context with relevant references. So you have to provide here references also, bibliography. Okay, here. So up to 500 words, rationale. From the problem statement, 500 words, rationale, 500 words. Now after that, you can go for the either research question or hypothesis. Okay, maybe you can say 1 or 2 hypotheses, but not more than 100 words. Your hypothesis or research question should be in the PICO format. PICO means patient or participant or population. P stands for this, I stands for intervention, C stands for control or comparison group, O stands for outcome. So your question or hypothesis must be in PICO format and it should not more than 100 words. Okay. Then comes to the next point. Based on the research question or hypothesis, you are developing the study objectives. So one objective should be not more than 25 words. They are saying that ideally not more than 3 to 4 objectives you should provide. Objectives based on the research question. Now define the objectives clearly and in the measurable terms. You know, you might be aware the word SMART, specific, measurable, achievable, reliable, and time. So your objective should be reliable, measurable, achievable, SMART objective. Like you people are smart, so the SMART objective should be there. Provide specific, measurable, and time-bound outcomes for each objective also. In that, you can mention that after 3 years of this intervention or project, we'll be able to reduce the burden of, let's say, 25% from the current, from the baseline, whatever. Just I'm saying, sharing these thoughts. Okay, so study objectives. So from my point of view, I will call this 6, 7, 8, 9 points as an introduction of the proposal. We write introduction, that is background statement. So background is problem statement, then rationale, then hypothesis, then research question. So it is basically, again, I'm saying introduction. Here we cover the broader issues. Let's say I'm giving the example of diabetes. What is the prevalence of diabetes throughout the world? Starting from the top. And then we are narrowing down with India to a particular region. What is the prevalence of diabetes in India? What is the prevalence of a particular region? Right now I'm sitting in Gujarat. What is the prevalence of Gujarat? So you are narrowing down basically from the broader issues. And then what is the immediate problem? In diabetes, what is the problem which you are looking? And then provide why you want to do a study, justification of the study, and then objective or hypothesis, which is SMART. So from my point of view, these 6, 7, 8, 9 points are known as introduction part. Rationale is problem statement, rationale, hypothesis, study objectives. So these total, 500, 500, 100, 1100, and then you can add not more than 1200 words. Everything should not be more than 1200 words. This. Okay. Now coming to the next point, that is methodology point. Methodology you should write, as Neeraj already mentioned, the objective wise. Let's say you have 3 objectives. So your methodology may be different for objective 1 to 2 or 3. So write down, if there's a same methodology, then write same methodology. No issue, but write separately. Study design, what is the study design? Achieve the objective 1. What is the study design to achieve the objective 2? Study area. It's a multi-choice, means whether it's a community-based, it's a hospital-based, it's a multi-center-based. Maybe one study is conducted in Ahmedabad, other in Baroda, other one in Bangalore. Like that, you have a 3-4 centers, multi-center studies. So write the study areas. Then sample size and sampling strategy. How we have achieved this much samples. So sample size formula, and then, describe each and everything in this. Whatever you have taken the parameters, write down this and total sample size for achieving the objective 1 or objective 2 or objective 3. And which methodology you are using. You can write, there are basically broadly, there are 2 groups of methodology, probability and non-probability. So in probability, there are 4 or 5 different types are there, like simple random sampling, stratified sampling, cluster sampling, and systematic sampling. So whatever the sampling strategy you are using, please mention this. And how you are selecting this sample, means how you are selecting the participant or patient, whatever. So write down the detail for this objective 1 or 2. Then project implementation plan, which is basically data collection plan overall. How you are going to collect data from each individual procedure-wise. Who will approach the participant, when you are going to approach. Okay, so what are the tests will be conducted on this person, what are the intervention will be conducted. So everything in the project implementation plan. Then design of the statistical analysis. Which type of analysis you are using? Broadly, we mentioned 3 types of analysis: descriptive, bivariate, and multivariate. But objective-wise, they are different. Number 1. Number 2, be specific what you are using for objective 1. Descriptive is okay. You can write that descriptive means if the variable is categorical, we use the percentage. If the variable is continuous, we use the mean and standard deviation. That's fine. But after that, mention the particular outcome variable and independent variable, which test we are using. T-test, chi-square test, Z-test, whatever test we are using, or odds ratio, relative risk, whatever based on your methodology, whatever we are using, please write this. For this, we are using this. Don't say blank statement. Okay, we are using this descriptive bivariate analysis and applicability test will be applied. No. Be specific for objective 1. What's your objective 1? What is your objective 2? And which test is applicable to this? And finally, if you are doing the multivariate or multivariable analysis, you can mention this thing also. Okay, to reach to the final model. Okay, so this is the detailed methodology. Then point number 11 is expected outcome, or what are the deliverables from this project. At the end, when you completed project, what will be known to the participant? If you have completed the all objectives, write down in 100 words. What is the expected outcome at the end of the project, at the end of all the objectives achieved? Let's say whatever you have achieved, then what will be your next step? Again, write in the 100 words. So what you will do? Let's say if you are looking for some, just I'm giving you some examples, say you are looking for some prevalence and risk factor for particular conditions. Okay, so these are this. After that, what will do? Okay, write down the points. What you will do? You can write whatever, okay, whatever maybe your institute and level, they can plan some intervention, or you may share the findings with the government. Your government can take this, whatever. So, okay, so write down in 100 words. Immediate next step. Coming to the point number 13, whether the study is going to generate some new intellectual property, some pattern, something different. Okay, so mention also this. Okay, as basically this is applicable mostly for the large grants, intermediate grants. Okay, something different pattern or some commercial advice. So write down this. Please write the details, but there's no limit here. And last point is timeline with the achievable target. Last point is timeline with the achievable target. Okay, either you can mention Gantt chart or you can mention the pie chart, program evaluation and review technique chart, whatever, but mention this. So in first quarter, we will do this project development, questionnaire development, code development, whatever. Okay, hiring of the research, basically associate or research assistants, whatever. So hiring, training, and everything will be completed in the quarter one. In quarter two, actual data collection will be started, and maybe you can select up to 1 year or up to 1.5 year, quarter 2, 3, 4, 5 data collection will be done. So likewise, you can mention the timeline and what are the targets. After 3 months, what we are going to complete. After 6 months, what we are going to complete. Okay, after 9 months, what you are going to complete. So this project is for 3 years. If you are submitting proposal for 2 years, that's also fine, not an issue. But maximum timeline is 3 years. So this is known as Annexure 1 Part A. There are 14 questions. Okay, 14 points. Write down in point wise. Okay, so first thing is develop the idea, discuss with your seniors, colleagues, friends, whatever you are there. Okay, then start developing the point wise on this. Once it is developed, okay, then try to fill in the online format. Now, format again, annexure 1, there's a part B also, which is mostly related to PI. And basically, this is if you have done some work, okay, right now, whatever you are submitting on the basis of this proposal, you have done some work. So mention this. So let's say you have done work some on cancer, on diabetes or hypertension or tuberculosis. Mention that I have done this work, okay, and as a proof of concept that they will know that PI is capable of doing this work. PI is, he or she is capable of doing this work, okay. This should be reflected through your papers, research articles. Skills and experience of the research team. Highlight only salient points, okay, from this, and along with 5 relevant publications. That provides confidence to reviewers that team can implement the project with the quality. Let's say PI and co-PI are there, okay, in that, and other persons are there. So whatever they have skills, please mention here. Skills of the whole research team. What are the PI's research skills? What are the co-PI's skills? And this should be demonstrated through research publications. 5 publications. Third point is institutional support. Okay, please mention 1 paragraph on, okay, how the interdepartmental and institutional support or collaboration is needed for implementation of this study. To mention the role and responsibility of PI and co-PIs. Let's say you have a two co-PIs. One is from medicine department, other one is community medicine department, one is from pediatric department or gynec department, whatever. Okay, are from different medical colleges or different colleges also. Okay, so please mention what the person will do, he or she will do. Okay, from that support. If it's a multi-centric study, then write these things. Okay. Fourth point is laboratory support, laboratory facilities. Mention the institutional resources, like such as animal house, if required, or instrument, if required, are present. Let's say you have you are working in a hospital, so you have everything is there. So please mention this, which is required for a particular project. Okay. And if any other thing is required, additional provide in the additional supplementary information. Now, budget, Dr. Neeraj already mentioned, they have a ICMR, they have a guidelines. Please look their website, okay, and provide the justification for each thing. If you are asking for something, why you need this, provide justification. You require 3 persons for the project. Please provide why 3 persons, person-wise justification. Okay, so this is the format for budget. Dr. Neeraj already mentioned about overhead, 3%, but remember, 3% should be on staff and contingency amount, not on everything. 3% will not be there for equipment. Okay, 3% only will be there on staff. Let's say you have 3 staff, so they will give 3% overhead on the staff and other contingency. So look for the contingency head and this, and then calculate the only 3%. ICMR will provide only 3% overhead charges to the institution. And this is the format for CV of PI and COPIA, which is mandatory. In this format, you can provide. Okay, we'll share with you this format also. Timeline, Dr. Neeraj already mentioned. Okay, submission has already started. It is on first come, first basis. Okay, you can submit whatever right now. It started, but last date is for the intermediate 29th Feb, for the smaller 21st Feb. Okay. Now, application procedure. Whatever Dr. Neeraj mentioned, this is the application procedure here. It is only through online mode by creating account of PI and co-PI, and principal investigator PI will submit the proposal online. Remember one more thing, number of ongoing projects should not be more than 5. Okay, ideally it should be less than 5 from the ICMR side to the principal investigator. Let's say Dr. Neeraj is principal investigator. So if he is having 3 projects right now, so he can apply for more project. Okay. But if he's having 4 projects or 5 projects, then he can't apply. Okay. The similar thing, the total amount should be less than 25 crore for all the projects. If he is having 4 projects, the total amount should be less than 25 crore overall amount. Another very important thing, wherever you are working, Dr. Neeraj already mentioned that it should be basically regular appointment. Apart from regular faculty or regular appointment, you need one certificate, which is from Department of Scientific Research and Scientific and Industrial Research. So it is known as CIRO certificate or DSIR certificate. Without this, you can't apply to the ICMR for the proposal. So your institution, wherever you are working, must have this certificate. Okay. Now coming to the scoring criteria, evaluation criteria, you have submitted the proposal. Okay, you have a certificate, you have submitted everything. Now, initially, 2 independent reviewers will review your proposal. Every proposal will be reviewed by 2 persons. Okay, first level screening. And first level screening based on these 5 criteria. What is the rationale of the project? Is it likely to solve a priority project problem? Yes, then basically, its maximum score 20 points. And what is the possible impact of the proposal? Okay, 20 points. What is some innovation and novelty? Is the study developing or testing a new idea? There's a 15 points for this. Methodology, look at this methodology. There are 30 points, highest points given to the methodology. And then implementation plan. Okay, whether it's a timely, completed in the time manner or not, or it's feasible or not. Let's say you are saying that one person is saying that I'm going to reduce the diabetes prevalence in particular area from right now, whatever they're from, till to 10%, which may not be feasible. Okay, maybe 6%, maybe 5%. Right now, let's say MMR or NMR or IMR. IMR, let's say for particular district is 35. And proposal is saying, objective is saying, I will reduce to 15, which may not be possible in this particular time period. So from 30, 35, you can say that, okay, 7 endpoints is okay, but not drastically reduced. So this may not be feasible in a timely manner. So once 2 experts will review your proposal after 100 points, if you got the 60 points after this 60 points, then it will go to next stage, which will be reviewed by a panel of 7 members. Once it is clear from 7 members and some queries, Then they will be reviewed by finally 3 members committee, including director of the ICMR. So this is the evaluation procedure. Okay. Look at this slide. There's a warning alert. Keep your iPhones or phones and valuables under watch. Thefts are being reported in the library. Okay. See the image. Second image. In case of fire, take the stairs. Okay. What I'm trying to make here point is please read and understand the guidelines correctly. Read each and every one correctly and understand correctly, and then start developing the proposal. Okay. This is the brief, overall brief of the proposal, how it looks, a skeleton of the proposal of ICMR proposal. Problem statement, rationale, hypothesis, research question, then methodology part, design, area, study area, implementation plan, sample size, analysis. Okay, then budget, institution support, outcome, future plan, timeline with the targets, okay, and skills and experience of the research team. This is overall in the nutshell of the proposal. Okay, if you have any question, technical question or something, then please write on these 2 emails. These are the ICMR emails. The persons will respond immediately. If there's a team, they will respond immediately. We have a past experience. They are responding very, very quickly. Okay. So thank you very much.
I think thank you very much, Dr. Rathi. Participant has any question, you can write in the chat box. The session is available on the YouTube also. I have
Yeah.
shared that YouTube link also on the chat box. You can later on see also. And question query, personal question query, you can write in the email also. So we will give you a proper guidance one-to-one whenever required, because this is really sometimes it's not easy. It looks very easy, but sometimes because of the small thing, we may feel stuck. So any question specifically? There are few points from the PPT availability. You can write the request for the PPT in the email. We will reply you and give you a PPT by email reply. So please write your specific requirement. We will not give the in general everybody. So please request for the PPT, we will send. Can foreigner national can be co-PI? I think co-PI point of view foreigner can be here. But you can still see the registration process. There should be a minimum requirement is a birth date certificate. Foreigners must have that registration procedure should be able to complete. Okay, that need to be see on the website. Without registration process, you cannot add a co-PI. Any question? Any more? I think no more question. Shall we end the session? Previously rejected one can be submitted again. Yeah, you can submit. You can see, evaluate your project as Dr. Rathi and the presentation said that what are the actually requirements? What are the weaknesses? You can find out that weaknesses, convert into strength, you can submit. Is there any limit for number of co-PI? I think not limit currently, but at least they are saying PI plus 2, maximum 3. But you can go, if your study is a multi-centric study, you can add a more PI as per the center. Pilot work mandatory. Pilot work is not required if you have actually a background information. Like I give you one example. One of my study on RCH in the particularly the construction site worker, you can say a labor worker. The study was submitted in 2012, and that time we don't have a zero certificate, so it was delayed in funding part. When we received the zero certificate, the study was the ICMR said we don't have a fund, so you can reapply. I have reapplied the same project in 2019 and it was approved in 2020-21. So it is not necessary. You can rejected project can be applied. You can give your first project also repeatedly with your modification, resubmit. So not necessary pilot, you can submit as a full proposal also. So I don't think this is a problem in the pilot, required to do a pilot before submitting. Publication 5, it is not mandatory. You can have a zero publication also, you can apply. You can start somewhere. Always you can start somewhere. So don't worry about this part. And PI experience in research area. See, experience from the actual application. I don't think the experience is required. All majority of the people already doing the MD/MS or MSc, PhD, they have some research experience. Okay. During that MSc, during that PhD, during that your MD/MS, you are doing the research. You can say, I did a research on this particular thing. So don't worry for the experience. You can go ahead with the whatever available experience. If no grant received from the ICMR, other organizations so far, what should be can written by the preliminary work? See, you can write clearly. If you are submitting something new, don't need to be a preliminary work. I am trying to start this work in this because I am interested and I am go ahead with this. You can say a no background preliminary work in particular area. Not necessary. Okay. Every time we do not require. What about grant less than 10 lakhs? You can try apply. Not necessary. You can try for the whatever amount of the grant. One of my colleagues faculty received 35,000 as a grant. So no need to worry about this part.
But the point is try to apply.
Yeah.
Try to work on basically these guidelines and apply.
Budget details, what specifically you understand, you want to understand, let us know by email. We will guide you further because it's very difficult what your requirement we are not able to understand. So please write mail, we will reply you definitely. Okay. There are few questions. One. Can faculty on contract be a co-PI? See, registration of the contract faculty will not be happen. So you have to be a permanent faculty. Official email.
Neeraj, Dr. Neeraj, contract may have different meaning here. Everybody is on contract for 1 year, 2 years, but all are permanent employee.
Okay.
So I don't know what context person is asking. So
Yeah,
contract
maybe.
means, yeah, everybody is on contract. Okay. So, but all are permanent employee.
My email ID already I mailed you via the link. Whatever link you received, that link is there. And in presentation, I am just again sharing the last slide of my presentation, so you can have a idea about the mail ID. You can write this particularly Neeraj for research @gmail.com. So you can use this mail for communication. New topic. If new topic, you can definitely apply. This is real innovation they want. So innovation they want. So no background information, something new, they always welcome. So don't worry about this innovation. I think all questions almost taken. If there is no new question, we can end Dr. Arti's session.
Yes, if there's no question or clarification, then yes.
Thank you, participants, and all the best. You need any help, please write us. We will definitely be in touch.
I think 100 plus 140 they have applied. Means
Yeah.
they were present here. So we can see maybe few proposal from this group.
Yeah, we hope. Definitely,
Yeah.
we hope positively.
Yes.
Thank you all. Riddhi, you can
Thank you.
close the session. We are also exiting. Thank you.